When you picture pirates celebrating after successful raid, you probably imagine hearty laughter echoing across moonlit waters.
Gold coins clinking in weathered hands, and rough voices singing sea shanties that carry for miles.
On ocean breeze. Hollywood has painted this romantic image so vividly that we can almost hear.
Those legendary pirate voices booming with confidence and joy. But here's brutal truth that those swashbuckling
movies never dare to show. Many of those voices weren't booming at all. They were screaming.
Screaming in agony as infected teeth were ripped from their skulls using tools that belonged in blacksmith shop rather than human mouth. Sound that really echoed across pirate ships wasn't triumphant laughter. It was desperate wails of grown men having their rotting teeth yanked out by shipmates who had never seen inside of medical school and were working with whatever crude instruments they could find in ship's tool chest. Picture this nightmare scenario. You're trapped on wooden vessel in middle
of endless ocean. Your jaw is swollen with infection. Pain is so intense you can't eat or sleep. And only person willing to help you is ship's cook, who's planning to use
same pliers he uses to fix broken rigging to extract your tooth while ship rolls through 10-foot swells. This wasn't just medical care. It was maritime torture that happened to sometimes cure.
Patient. And every pirate who survived long enough to tell tales knew that dental agony.
Not enemy cannon fire was often thing that could break even toughest sailors' spirit and turn feared sea wolf into whimpering mess begging for relief. Life aboard pirate ship was basically recipe for dental disaster, combining every possible factor that could destroy human teeth into one floating nightmare of poor nutrition and impossible living conditions. Pirates spent months at sea eating food that would make modern prisoners fight complaints with human rights organizations. Their daily diet consisted mainly of hardtack. Ship's biscuits so tough they could chip teeth just from normal chewing. Salted meat that had been preserved in barrels for so long it had turned into something resembling leather and whatever sugar. They could steal from captured merchant vessels. Sugar was particularly devastating because pirates would consume it
straight from barrel when they could get it, having no idea that they were basically feeding
bacteria in their mouths an all-you-can-eat buffet. Hardtack was infested with weevils and had to be soaked in water or rum just to make it soft enough to bite. But even then,
It was like chewing on salted rocks that gradually ground down tooth enamel over months and
years of meals. Fresh fruits and vegetables were rare luxuries that might appear for few days after
the raiding merchant ship. But most of time, pirates survived on preserved foods that lacked vitamins. Their bodies needed to maintain health, teeth, and gums. Scurvy wasn't just about losing energy and getting sick. It also caused gums to become soft and bleeding, making teeth loose and prone to falling out on their own. Add in complete lack of dental hygiene, since nobody had heard of toothbrushing, and clean water was too precious to waste on mouth rinsing. And you have situation where even young pirates in their 20s were dealing with advanced tooth decay. That would horrify modern dentists. When tooth pain became unbearable and extraction was only option, pirates faced terrifying reality that their ship's dentist was probably whoever happened to be least squeamish
about blood and had steadiest hands available. Real trained surgeons almost never sailed with pirate crews. since legitimate medical professionals could make better money and live safer lives working for naval ships.
Or wealthy merchants who didn't spend their time getting shot at by angry governments. So job of tooth extraction usually fell to ship's barber, if they had one, since barbers in those. Barbers did perform basic medical procedures as part of their trade. More often, it was assigned to whoever seemed most capable with tools, sometimes ship's carpenter, who was used to working with. His hands had a good selection of pliers and extraction devices, or a cook who was skilled with knives and had experience cutting through tough materials. In desperate situations, job might go to whoever was brave enough or drunk enough to volunteer, regardless of their actual qualifications for performing. Oral surgery on conscious patient who was about to experience medieval levels of pain. These improvised dentists
learned their trade through trial and error, with heavy emphasis on error part, and they're early.
Patients served as unwilling test subjects in procedures that often went horribly wrong. Some ships developed reputations for having particularly skilled tooth pullers, and these men would be borrowed by other crews when dental emergencies arose, traveling from ship to ship like medieval specialists who happened to work with stolen medical equipment and rum-based anesthesia. Actual process of extracting teeth on pirate ship was masterclass in making.
Best of impossible circumstances while inflicting maximum suffering on everyone involved. Pirates had discovered that rum,
Consumed in large quantities, was closest thing to anesthesia they were going to get, so patients
would be encouraged to drink themselves into stupor before procedure began. This had dual benefit of
numbing pain and making patients less likely to struggle during extraction, though it also made them
more lively to vomit during procedure, which added another layer of unpleasantness to already horrific experience.
actual tooth extraction required creativity and improvisation, since purpose-built dental tools were rare on pirate ships. Some crews used iron tongs or blacksmith's pliers, which were strong enough to get good grip,
but often crushed teeth rather than pulling them out cleanly. Others favored rope method, tying strong
cord around offending tooth and then yanking it out with sudden pull, sometimes literally tying other end to mast or cannon and using ship's movement to provide extraction force. This technique had advantage of being quick, but it often resulted in broken teeth, damaged gums, or accidentally pulling wrong tooth entirely. Iron pliers method was more precise but required incredible strength and skill to avoid breaking patient's jaw or causing permanent damage to surrounding teeth. Regardless of method used, pain was absolutely excruciating, and sounds of extraction, cracking bones, tearing tissue, and agonized screaming became routine parts of life.
Aboard ships where dental emergencies were common occurrences, before resorting to extraction, pirate crews often tried
various home remedies and folk cures that ranged from surprisingly effective to absolutely disastrous. Cloves were highly prized by pirates who could get them, since oil of cloves really does have numbing properties that can temporarily relieve tooth pain, though relief was limited, and cloves themselves were expensive enough
that using them for dental care was luxury and most crews couldn't afford. Tobacco was commonly used
as pain reliever, with pirates packing wet tobacco leaves directly into tooth cavities or around infected gums, and while this probably didn't help much with underlying infection, nicotine did provide some temporary numbing effect. More desperate crews would try rinsing their mouths with seawater, which had advantage of being readily available but often made infections worse due to bacteria and other contaminants in ocean
water that hadn't been properly filtered or boiled. Some pirates believed that packing wounds with gunpowder
would help them heal faster, following same logic they used for treating other injuries. But putting explosive powder into infected tooth socket was usually the recipe for making infections spread rather than curing.
Most bizarre remedy involved mixing various substances into pastes that were supposed to draw out
Infection, combinations of rum and crushed garlic, ground bones and vinegar, or even human urine mixed with herbs, most of which had no medical value and often made problems worse by introducing new sources
of infection into already compromised tissue. Challenge of performing any kind of medical procedure on ship.
that was constantly moving created additional layers of complexity that turned routine tooth extractions into life-threatening ordeals. Ocean swells could turn steady-handed dentist into dangerous amateur in seconds, and rolling motion of ship meant that both patient and practitioner had to brace themselves against sudden movements that could turn careful extraction into accidental jaw-breaking disaster. Pirates learned to time their procedures with ship's movement, waiting for relatively calm moments between waves to make their moves, but even smoothest seas provided enough motion to make precision work nearly impossible. Lanterns swinging from ceiling cast moving shadows that made it difficult to see clearly, and cramped quarters below deck meant that there was barely
enough room for patient to lie down, let alone for dentist to work comfortably. Patients would
bite down on rope, leather straps, or wooden blocks to muffle their screams and prevent them from biting off their own tongues during procedure, but rolling ship made it difficult to maintain steady bite, and many patients ended up with additional injuries from losing control during moments of intense pain. Person performing extraction had to brace their feet against ship's ribs or deck beams, while trying to maintain enough leverage to pull teeth without losing their balance or accidentally injuring patient when ship suddenly lurched to one side. Some pirate surgeons became legendary for their ability to work in these conditions, developing techniques for bracing themselves and their patients that allowed them to perform relatively successful extractions even in rough weather. In culture where toughness was currency and showing weakness could mean losing respect or even being abandoned at next port, pirates developed elaborate rituals around tooth extraction that turned medical procedures into tests of courage and endurance. Some crews made collections of extracted teeth, stringing them into necklaces or keeping them in jars as proof of dental ordeals they had survived, with men comparing size and condition of their extracted teeth like trophies from particularly difficult battles. Others would toss extracted teeth overboard, with elaborate curses aimed at enemies, believing that disposing pirates would often brag about their dental extractions with same pride they shewed for battle scars, claiming that losing fewer teeth than their shipmates was proof of superior toughness. Men who had survived multiple extractions without screaming became legends whose reputations for pain tolerance made them valuable in combat situations. Some crews developed betting pools around tooth extractions, wagering on whether patient would pass out, how many attempts it would take to remove tooth,
or whether extraction would be successful or end in disaster, turning medical emergencies into entertainment that helped distract everyone from horror of what they were witnessing.
The spectacle created a strange mixture of fascination and horror, with onlookers unable to look away from England's. These dental ordeals became defining moments aboard pirate ships, creating shared experiences that bonded crews through Deuce. The brutal necessity of dental extraction aboard pirate ships evolved into a complex culture cope with reality that dental pain was an inevitable part of their lives, but they also created additional pressure on patients to endure procedures without showing weakness, sometimes leading to dangerous situations where men would refuse necessary treatment rather than appear cowardly in front of their shipmates. Pirate history is filled with legendary stories of dental disasters that became cautionary tales told around ship campfires for generations.
Each one more horrifying than last, but somehow also darkly funny in a way that only stories of extreme suffering can be.
There was Blackjack Morrison, who allegedly had same infected tooth pulled 3 times by different crew members before anyone realized they were yanking on the wrong tooth. And real problem was on other side of his mouth, by which point his jaw was so damaged he could barely eat solid food for the rest of his life.
Captain Samuel Hartwell became famous for losing half his lower jaw when botched tooth extraction led to bone
Toothaches. These legendary disasters served as both cautionary tales and darkly humorous entertainment, helping pirates cope with atrocity. Through pain, disaster, and dark humor, pirates transformed dental necessity into cultural identity. And so, from the most basic human need for dental relief, pirates created an entire culture of endurance, infection that spread faster than his crew could treat it. But he continued commanding his ship by communicating through gestures and written notes, proving that even catastrophic dental disasters couldn't stop determined pirate from pursuing his career. Most famously, there was incident aboard Revenge, where ship's cook tried to extract his own infected tooth using pair of meat hooks and mirror, only to slip during the particularly violent wave and accidentally hook his own tongue, leaving him unable to speak clearly for months.
And earning him the nickname Mumbles McGillicuddy from his unsympathetic shipmates.
Liz and Chovries. These stories served multiple purposes. They entertained crews during long voyages. They taught valuable lessons. They entertained crews during long voyages. They taught valuable lessons about what not to do during dental emergencies. And they helped establish reputations for men who survived them, since any pirate tough enough to endure and recover from legendary dental disaster
Was obviously someone you wanted on your side during fight.
But they also highlighted incredible risks that pirates faced from what we would consider routine medical issues. Consider routine medical procedures, showing how easily simple toothache could become life-threatening emergency when proper medical care was weeks or months away. As we look back across centuries at these masters of improvised dental care, we see different kind of courage than swashbuckling bravery. Hollywood loves to celebrate. Missing teeth and scarred jaws that marked veteran pirates weren't just signs of poor dental hygiene. They were proof of incredible willingness to endure unimaginable pain rather than let infections spread and kill them slowly. Every gap-toothed smile was evidence that someone had chosen agony over death, had trusted their life to shipmate with no medical training, and crude tools, had survived procedure that would terrify modern patients, even with professional anesthesia and sterile conditions. Pirates learned to laugh at their dental disasters because alternative was to cry, and their toothless grins became symbols of their ability to find humor. In situations that would break most people's spirits entirely, they proved that human resilience knows no bounds when survival depends on it. They proved that even in the face of unimaginable suffering, the human spirit can not only endure, but transform. And so, the story of pirates pulling teeth on moving ships becomes eternal testament to that survival isn't always about avoiding pain. Sometimes it's about learning to embrace suffering as necessary part of staying alive, and finding ways to turn even most horrific experiences into stories that bind communities together through shared trauma and mutual respect. When those legendary pirate voices finally did boom with laughter across moonlit waters, they were often missing half their teeth, but they were laughing anyway, because they had learned that sometimes greatest victory isn't avoiding pain, but surviving it with enough spirit left to joke about how much it hurt. Their dental scars weren't signs of weakness. They were proof that these men had looked death in eye, spit blood in its face, and sailed away to fight another day, even if they had to gum their food for rest of their lives. Pirates turned dental agony into badges of honor, proving that human spirit can survive anything, even having teeth ripped out with blacksmith's tools, on rolling seas. They proved that the human spirit is indeed indestructible, that courage can bloom even in the darkest moments of agony.
And that sometimes the greatest legends are born not from avoiding suffering, but from learning to dance with it.